Good afternoon, and thank you all for being here today. Earlier this morning, we had an excellent meeting with Dr. Deborah Burks, who was in Mississippi as part of her tour across the South, as well as Dr. Dobbs and his entire team, and several community leaders, political leaders, and business leaders from across the state. Dr. Burks has been visiting several states across the South as we deal with increased COVID-19 cases and obvious hospital system strain. I will tell you that Dr. Burks has been a tremendous partner for Mississippi throughout this fight, but it was especially great to have her on the ground here in our capital city. She offered some excellent insight, reiterated that she and the Trump administration are available to help in any way that we need. She also was very complimentary of Mississippi's innovative approach to this mission. She recognizes that we are not just chasing what the national headlines say is the latest silver bullet. We as Mississippians are leading, and they have noticed. They appreciate it, and they support it. I don't want anyone who is paying attention today to mistake the confidence that I have in the team working on this with the notion that all of our problems are solved. We as a state have serious challenges, but with leadership, they can be addressed. We can come through this. Dr. Burks reiterated the Trump administration's firm conclusion that masks work, and masks can help prevent further economic shutdowns. We know that further economic shutdowns is a pain in many of our communities that is not sustainable, and that it contributes to our people giving up on our mission. While we are dealing with the hospital challenges that we have and other transmission in COVID-19, our other work does not stop. For example, earlier today, I announced that former Senator Gray Tollison would be taking over the circuit judgeship in the 3rd District of Mississippi. Senator Tollison has been a friend and an ally of mine for many, many years. He is a recognized legal mind. He did wonderful things in the Mississippi legislature as chairman of the Judiciary Division B Committee, as well as for the last 8 years providing opportunities for Mississippi kids as Education Committee chairman. And I know he will be a fantastic circuit judge for that area of our state, and I'm glad and honored that he was willing and able to take that appointment. In addition to that, today we want to announce several new measures to help in the economic crisis and the health crisis that we are facing. The first is a hub for Mississippi businesses, Mississippi schools, Mississippi churches, and other organizations to be able to purchase masks, gloves, hand sanitizer, and other PPE that is made in Mississippi. For too long, we relied on our nation's adversary in China to produce this equipment. Today, there are many small businesses throughout Mississippi who are stepping up, competing, and offering these critical goods. This was one of many brainchild of the Restart Mississippi group that we pulled together from the private sector. It was created by the Mississippi Development Authority, and now you can go online to www.ms-ppe.org to check it out. Let me say that again, www.ms-ppe.org. We've listed several Mississippi companies along with the goods that they can offer and contact information already. And there's a simple form for other Mississippians and other Mississippi companies to join the list. In our Restart Mississippi committee, we had a ton of talented Mississippians that contributed to that effort. Today we have with us Monica Hargill, who led the small business subcommittee of that group and she is here today to tell us a little bit about this new initiative and how it was conceived. Monica, thank you for your dedication to the people of Mississippi. Thank you for your friendship, and thank you for being here today.
Thank you, Governor. As most of you probably know, Governor Reeves created Restart Mississippi to serve as an advisory group to focus on economic revitalization. And the group has been hard at work. As Governor Reeves said, I'm co-chairman of the Small Business Subcommittee. And over the last many weeks, the group has been focusing on different initiatives that can help Mississippians right now, while the entire group continues to focus on more mid-range and long-term economic ways to boost our economy. We also look at what's needed right now in small-town Mississippi by our small businesses. And we realized very early on that access to PPE in a readily manner was difficult and hard to come by for those small businesses. And they weren't buying things by the hundreds and thousands. So with the MDA and MEMA, we were able to come up with a way to have this website, this resource digital hub, where now all businesses can go, small businesses, large businesses can go and find products that are made both for Mississippians here in Mississippi. So if you have any questions in the future, Restart Mississippi has its own little webpage, and it's www.restartms.ms, and we continue to focus on ways to boost the economy.
Thank you, Monica, for your efforts. This has all been a volunteer effort by Mississippians who are helping grow Mississippi's economy, and Monica has done a fantastic job, as have all of the members that she represents here today. We also have Director Turner here today from the MDES. Her department is also launching a website to help solve a critical problem that we have within our unemployment system. And that is, and you've heard us talk about it before, unemployment fraud. We've had issues with fraudulent claims, as well as people who have been offered a chance to work who would rather stay on unemployment benefits indefinitely. This system prevents illegal unemployment payments from going to people who do not qualify. It will help ensure that our system is solvent for those who truly need it. It allows employers to report rehiring, refusal of work, inability to locate, or potential fraudulent or identity theft cases. That information sharing is critical as we work to get assistance to the people who need it and try to get our economy moving in a safe way. At this time, I'm going to turn it over to Jackie to give us some updates.
Thank you, Governor Reeves. It's my pleasure to be here today with Governor Reeves and Monica. We have worked closely at Employment Security with the Restart Committee, and the Restart Mississippi portion of unemployment was born out of a conversation and a relationship with the Restart Committee, and hearing employers and people filing for unemployment, their needs for needing to tell us something in a more robust way than the regular way that they did it in normal times. Everything is different because it's the unprecedented claims load, so we had to find a better way for the things that Governor Reeves described for employers to tell us. Before I get to that, I wanted to give you a few statistics as we come here today on July 15th. Since the week ending March 14th through the week ending July 4th, there's been approximately right under 400,000 unemployment claims filed. And as of the week ending July 4th, there has been about half of those, about 200,000 of that 399,000 that are continuing to file for unemployment. Now, there are 7 different unemployment type programs that we are running or that we're responsible for administering in employment security, including the regular unemployment program, the pandemic unemployment assistance program, some disaster unemployment, extended employment, it goes on, but all these programs have their own complex rules and regulations, and then they have to interact together to best fit or to serve the needs of the person out there that needs the unemployment. So you can see from those statistics that we have about half that started off, they're still filing, and there are a couple of important dates that I wanted to mention. Number one, Governor Reeves' Executive Order 1502. It has provisions that we started out with executive order with certain provisions. We ended some of those provisions at the end of June. Some extend to the end till July 25th. That's a very important date for both those who are receiving unemployment and for businesses as well. Please review that Governor's Executive Order 1502. It's on the MDS website, Secretary of State's website, and also the FPUC, Federal Pandemic Unemployment Compensation Program, which is what we call the extra $600 that's added to each of those 7 programs that I talked about. If a person is receiving any of those 7 programs right now, they get an additional $600. As it stands right now, that program will end the week ending July 25th. So we will be sharing things on social media, doing interviews and those kind of things to discuss what that means for individuals, what that means for employers, and also pushing our Restart Mississippi initiative that Monica and Governor Reeves are been so gracious to engage with us, and we appreciate that. We've had 1 or 2 in-person meetings and some virtual meetings with the Restart Mississippi members, and it was born out of that, and it does provide a mechanism, a more robust mechanism, an automated mechanism for employers to tell us things, and I'll go over those one more time. Tell us when you are rehiring someone that maybe you laid off before, they're coming back to work. When someone refuses work. When you are looking for employees that maybe you laid off and you cannot locate them, maybe we have information on those. It's to help us and you. And then there may be situations where someone never separated from their employment. It may be fraudulent, it may not be fraudulent. But Governor Reeves spoke of the fraudulent portion of that, and that is very real for us right now across the country, and specifically in Mississippi. Fraudulent claims may be identity theft. They may be someone that does not qualify for one of the unemployment programs because they are not unemployed. Having employers tell us these things about potential fraud or ID theft claims helps us recover fraudulent payments and quit allowing individuals or ID theft rings to be drawing unemployment because it is not allowable to do so. So we're very excited about the use of the program. Employers that contribute to the unemployment insurance tax system, both rated and reimbursable employers, received a letter in the mail with an authorization code. And that code and that letter tells employers what to do and when to do it. It is also found on our MDS website at www.mdes.ms.gov. So we encourage employers to help us help you. It will help us both by taking care of these things in an automated fashion, which will speed up the process. So thank you.
Thank you to both of you for your efforts. This has been a collaborative effort of the public sector and the private sector and individuals from all over Mississippi. These are just 2 of the initiatives that they have enacted. When you look at much of the legislation that passed by the Mississippi legislature with respect to CARES Act funds, many of those ideas came directly from the Restart Mississippi Commission, and I am very proud of all of their work, and we'll continue to make announcements with respect to this over the coming days and weeks. At this time, if I could ask Dr. Dobbs and Mac to come up, and these 2 will be available for questions later should you have questions. I want to reiterate to the people of Mississippi the importance of continued vigilance with respect to COVID-19. Dr. Dobbs will give you the numbers later today. We had a very, very high day today. Again, we know that we have a delay in some areas and in some private labs on reporting. Our numbers are likely to continue going up in the near future, but we are hopeful that we can continue to put in effect mitigation measures, some of which we talked about earlier today with Dr. Burks. At this time, I'm going to turn the mic over to Dr. Dobbs to give us an update on where we find ourselves today.
Yes. Governor, thank you. For today, we did report an increase in cases. We were reporting 1,025 new cases with, sadly, an additional 18 deaths. We continue to see ongoing outbreaks in nursing homes, more and more every day. If we look at our hospitalizations, we're seeing increased hospitalization rates, which is not surprising. Again, something we expected and have seen worsening over the past couple of weeks. Presently, we have 825 individuals diagnosed with coronavirus who are hospitalized, a significant increase from yesterday, and a total of 1,099 if you include diagnosed cases and suspects. We see increased utilization in our ICUs up to 274, and on ventilators 132. If we look at the daily number of patients admitted with a confirmed coronavirus, it's increased pretty significantly. As early as recently as June 14th, we were admitting about 40 patients a day with coronavirus, and now we're admitting on average 87 coronavirus patients a day. This is confirmed patients. If we look at the breakdown of hospitalizations, of course, most hospitalizations are not from coronavirus. They're from other entities. But if we look at the ICU admission, or currently patients with ICU admission, there are 240 that have coronavirus versus people who don't have coronavirus in the ICU is 473. So approximately 1/3 of our entire ICU capacity is occupied with coronavirus. It's a remarkable proportion. If we look at our hospitalized patients, there are 825 hospitalized with coronavirus and an additional 3,751 who are hospitalized with non-coronavirus conditions. This is something we'll continue to watch closely and work closely with our physicians and hospital partners to try to make sure everybody has access to the best possible health care. The best thing we can do for our hospital is to keep from spreading in the community. Again, using masks, maintaining 6 feet separation, small groups only, and stay home when you can, and that'll make a huge difference. Thank you, Governor.
Thank you, Dr. Dobbs. We have Mac McCraney here today, the Deputy Director at the Mississippi Emergency Management Agency, that's going to give us an update from the emergency management team.
All right, thank you, Governor. I just want to let everybody know that on the website today, we announced yesterday about the municipalities and the county program. So today we actually have on the website is going to be the allocations that you'll see by city and by county. And we fielded many questions over the last 24 hours, as you can imagine. And we've tried to assure everyone that MEMA is thoroughly ready for the process. We've already been doing the process on PA. And our federal disaster number is 4528, and that is the COVID response for the state of Mississippi. And on the federal website, it is still open. So there's no ending date to apply. So we encourage all our PA public assistance partners, public utilities, whether it's schools, cities, et cetera, to go ahead and apply on the program. And it's at msema.org. That's MississippiEMA.org. And you can go ahead and register on that site and start getting your information together and do your request for public assistance. To caveat on the backside of that, we field a lot of phone calls from schools. So even on that website, we have a banner that talks about schools, the individual schools, whether it's a county school or whether it's a city school, who's taking care of them for their PPE needs, whether it be hand sanitizer and other things. And we've got some frequently asked questions on that page. There's a whole COVID tab that gives you frequently asked questions, what the processes are, and it even gives you, well, if I don't know anything, just send an email to this person. It's recovery1@MEMA, and we're going to get an answer back to you very quickly to let you know what the route is, how you can get taken care of, and how you can get in that hopper so we can take care of you, get those things that you're going to need for the upcoming school year, et cetera, et cetera. We continue to deliver over supplies, Governor, to all 82 counties, Band of Choctaw Indians. About 185,000 miles have been traveled so far. So our partners in the National Guard continue to do a stellar job of assisting us in warehouse operations. We have still the acquisitions team that is still ramped up. We're still receiving supplies in, and as we get organized for the fall here, we're going to be ready for anything that this disaster or others might throw our way. On the last and final note, I'll say that since February of 19, about 17 months ago, we have now engaged all 82 counties Even if you take out COVID-19, there's 81 counties, and the Band of Choctaw Indians have been affected by some sort of disaster. We're looking at the April 22nd and 23rd storm and the Cristobal that just came in. We're looking at almost 9 to 10 federally declared disasters that the Mississippi Emergency Management Agency, along with its partners, FEMA, they're an invaluable partner for us, as well as the Guard and others. We're able to do the things that we need to do for the communities and for the citizens of the state of Mississippi. Please go to the website, the COVID-19 tab, if you have any questions further. It gives you the contact numbers and the emails, and we'll get the state put back as whole as we can get it, sir.
Thank you, Mac. Again, I want to reiterate the effort that has been huge by both the Mississippi Department of Health as well as the Mississippi Emergency Management Agency. Dr. Burks, having been in charge of the coronavirus task force, along with Vice President Pence for the last 5 months, really spent a lot of time today telling us how well some of these entities in Mississippi have worked. The fact that we have gone through major disasters, whether they're hurricanes or tornadoes and other disasters. The team that has been built at the Mississippi Emergency Management Agency since Hurricane Katrina is superb. The team that has been built by Dr. Dobbs, both before and after 2020 came, has been superb, and we're doing a lot of things right. We've got a lot of work to do. We've got a lot of challenges before us. We know that, but it's good to have folks who have a national perspective and really know what's going on in other parts of the country. You know, we are all uniquely focused on our data, our numbers, our response. Well, they get the advantage of seeing data from all over the country and the response from all over the country, and that was certainly, for me at least, very encouraging to hear Dr. Burks brag on a lot of the good things that we're doing in our innovative approach to things. And I will just tell you, I want to give all the credit to our partners at Department of Health and at MEMA and their partners at National Guard. And I mean, we've just had a huge effort by Mississippians. Unfortunately, we're still in the middle of it, and things are getting worse, not better, on a daily basis in our state. We have identified it. We are taking steps and measures to help deal with it. But the hospitalization piece is one that Dr. Dobbs and I have been talking about now for 10 days, maybe 2 weeks. You know, it shouldn't come as a surprise to anyone, but the mere fact that we currently have 132 patients on ventilators for months, that was between 60 and 80. We're close to double the number of COVID patients on vents. This virus is real, but the encouraging news is there are certain measures that we can put in place, such as encouraging everyone to wear a mask, and I felt pretty confident when Dr. Burks talked today that they really believe, the entire Trump administration believes, that masks can make a real difference. And I see out in our communities, I saw it over the weekend on the coast, I've seen it some here in the metro area, more and more people are adhering to that. And the higher the percentage of compliance we get, the less transmission we're going to have in our communities. And I think that's important. So with that, I will again thank Director Turner at MDES for her work. You know, early on when the unemployment, when you have 400,000 claims filed over a very short period of time, they were under the gun and they just did yeoman's work. And I know that it was frustrating for individuals that everyone, all 400,000 couldn't get their claims filled in one day. But I want to tell you how proud I am of Jackie and her team. They have done tremendous work. And then Monica, who was here earlier, a small business owner who dedicated her time in very challenging times to help put together this website and put together our plans for small businesses, which ultimately ended up in the form of $300 million going to small business owners throughout Mississippi. So with that, thank you all for being here, and we'll turn over the floor for questions. Courtney?
Governor, both you and Dr. Dobbs, I know you all have had communication with Dr. Burks throughout this process on the calls that you all have referenced, but any other takeaways or suggestions that came from her today, any surprises or reiterations of things that you all have maybe been talking about that it helped solidify that you were taking the right steps, or that maybe we should take additional ones?
Yeah, so that's a great question. And I'll begin and I'll turn it over to Dr. Dobbs. He probably better understood a lot of what she said, because she's very science focused and data focused and medical focused, and I'm just a governor. So Dr. Dobbs probably understood more of what she said than I could. But a couple points that I would point out that stuck with me. We're in the middle of this, and our hospitalizations are going up. Our number of cases are going up, and when we think about the number of increased cases compared to where we were 2 months ago, we're all very concerned. And we have real hospital utilization issues as we speak. After we met with Dr. Burks, Dr. Dobbs and I and his team, we spent several hours talking about next steps and options and what can we do from a hospitalization standpoint, what can we do in other areas. And so I don't want to belittle at all where we find ourselves today. One of the takeaways that I had today is, while things are really bad here, they could be a lot worse. And if we don't, as a state, make good decisions now, and as individuals in this state make good decisions now, it could get a lot worse very quickly. Even when you look at our neighbors to the west and our neighbors to the east, we're in much better shape today than they are. And that's something that it's hard for us to keep in perspective, because the only thing we're focused on is trying to protect all Mississippians. But she has the advantage of seeing the numbers in Texas, seeing the numbers in Louisiana, seeing the numbers in South Carolina, seeing the numbers in Florida and in Georgia and in Alabama. The second takeaway that I would say is she is very pleased with our mask mandate in the 13 counties that we have done so. She very much believes that masks can make a difference. The one other thing that she mentioned that we've got a lot of work, we got some conversations to have, is bars. If you look at what's happened in other states, Texas has shut down all bars. I think Florida has shut down alcohol consumption in bars, and it became very evident to me that my Republican governor colleagues in those two states, all of whom are certainly competent enough to make their own decisions, but it seems to be a pretty strong recommendation that particularly young people who are going to bars and hanging out all night, for whatever reason, they tend to veer away from wearing masks while in bars and veer away from socially distancing, and that is not a good recipe for success. And so those are the 2 points that I would say that I took away from today. One of which was a positive, one of which is, hey, maybe we need to do some more work on this and make some additional decisions. Dr. Dobbs.
Yes, I think it was really good to hear the strength of the recommendation around the masks, wearing masks in communities. The more data that's available, we're seeing how effective it is and what a great strategy and an easy strategy it is. There were some publications at the MMWR from CDC looking at where they would have in a like a hairstyling salon, they had 2 infectious workers, and they had over 130 clients, and not one of them got it because both were wearing masks. And I feel like that's a pretty strong endorsement of the power of masks. More data is available. What a simple, easy, effective intervention it is. The other thing that was good to understand her perspective is the real emphasis of how asymptomatic spread is such a big component of what's going on. And so part of that is we've got to assume everyone's got it. We can't let symptoms be the way that we sort of cull out our social gatherings, because so much of the spread is either asymptomatic or minimally symptomatic. So that's got to fit into our strategies. I was encouraged to hear there's going to be additional investment in Mississippi and other states that have high caseloads in our long-term care environments as far as testing and making more rapid testing available. That's going to be a resource that we're really excited about. And the last thing, it was good to hear updates on vaccine trials. I think they're moving along well, but still it's going to be many months before that's a tool that we can use.
Governor reached out to some law enforcement agencies, municipalities, asking if they are going to try to step up enforcement on the mask rules and things like that. They say they don't have the resources. Do you want them to do that? If we don't see a decline, do you extend the order even longer?
The answer to your second question is yes. We are committed to doing everything that we possibly can to slow the spread of this virus so that we protect the integrity of our healthcare system. We understand that no local jurisdiction nor any state jurisdiction have the resources available to ensure that every single person wears a mask no matter what. But I do think that if local officials, and this is the reason I had a call with supervisors yesterday, I had a call with the municipal league yesterday, we do believe that if there's buy-in, not only by state officials, but also buy-in by the local officials, if there's buy-in by law enforcement to wear masks, we are seeing much greater compliance. I'll tell you anecdotally, we are seeing much better compliance with wearing masks today than we did 5 or 6 days ago, and significantly better than we saw 2 or 3 weeks ago. People are understanding the importance of it. Now, one of the conversations we had today, Dr. Burks has worked all over the world and spent the better part of her career working on HIV and other things in Asia and in Africa. And one of the points that I found striking today is that, you know, when you go to Asia, particularly China and otherwise, in many instances, a lot of those individuals have been wearing masks for years and years and years. And so it's sort of in their culture, wearing a mask is not seen as anything other than somewhat normal. Well, in America, that hadn't been the case, and it's certainly in the case in Mississippi. And so they had an easier time convincing their general public to wear masks than maybe we have here in America. But we're not going to have enough law enforcement officers to go and arrest people who aren't wearing masks. You're probably not going to get arrested. But that's not just because you're not going to get arrested doesn't mean you ought not do it. And so we are urging all Mississippians to wear a mask in public. You will help us slow the spread if you wear a mask, and if you help us slow the spread, you are going to be helping save lives. There is no doubt about it. I mean, it is very clear that much of where we find ourselves today started by young people who are, in many instances, asymptomatic, spreading it to their moms and their dads, which ultimately got to their grandmoms and granddads. When it gets out in communities, no matter what we do, it ends up getting into either a healthcare worker or a worker at a long-term care facility, and they take it into the facility. A lot of times, it's not intentional. No one is necessarily doing this on purpose, but it's just the natural flow of what a pandemic looks like, and that's where we find ourselves. Joe?
Dr. Dobbs, we kind of know the formula to respond to COVID-19 absent a vaccine. We've been talking about it since January. Are we following that formula? If not, why not? Because we see countries, civilized countries, reporting 400 cases. I think Germany did today, the entire country. Are we following that formula? And if not, why not?
I think for a country like Germany that does have robust testing, that's a proper comparison, right? So we know what the tools are. It's getting those tools to work properly, and certainly without overly harming the economy and other parts of health, mental health, et cetera. So just we are trying as hard as we can to implement the tools, the masking, the social distancing, the group situation without being overly coercive. Goldman Sachs, no socialist enterprise at all, strongly endorses masking, and even a modest increase in masking could save our economy up to $1 trillion. Why in the world are we not doing that? It's absolutely maddening. So we'll continue to promote it as aggressive as we can, whatever strategy seems like it's going to be most effective, especially in those areas where we see the highest impact. We are definitely not using our tools to maximum efficacy. The tools that we have are very simple and very effective, but we're all very aware of the challenges of implementing them, especially in populations like young folks who don't really see it as relevant to them, when in fact it certainly can be. And we do have severe illness and death in young folks, just not as common, but it certainly affects their families, friends, and loved ones.
And just a quick follow-up, Alabama just issued a statewide mandate for masks. Would you be looking at them in comparison to Mississippi, just as a gauge to see what does a statewide mask mandate means for a state that's seeing surging cases.
Yeah, it'll be interesting, and it'd be fantastic if we really had data on utilization, right? So the real thing is how many people you get to use a mask, not the mandate piece. So yeah, we'll be watching it closely, and just know that from the public health perspective, it's our objective to get people to use safe behaviors, whatever mechanism is the most effective. We do have these hotspot areas, and appreciate the governor making the tough decision to go to those areas, and a lot of them are populous areas that have a lot of the cases. And so we really need to focus on those areas, and that's something Dr. Burks was actually keenly aware of. The 5 counties that she mentioned are the ones, are some of the DeSoto, the Jackson Metro, Harrison, but also Forest County are really on their radar. And we'll continue to watch them closely. Local leaders have done great. I know, in Hattiesburg, they have their own mask ordinance, very supportive of that, and we'll continue to promote it in every way possible.
Yes.
Governor, as we approach next week, we have thousands of Mississippians that are on unemployment, and a lot of them rely on that extra $600 to be able to get by because their jobs have, maybe even because their jobs are not doing well right now because of the economic impacts. They've been laid off. What is your concerns for those thousands of Mississippians that are relying on unemployment right now, and that's going to be disappearing next week?
Well, the unemployment's not going to be disappearing next week, but what is going to be disappearing is the extra $600 for pandemic unemployment assistance. That was passed in the CARES Act. That was passed by the U.S. Congress. I think what you're going to see in my conversations with the Vice President and the Treasury Secretary, Mnuchin, and others, there's certainly an appetite in the Congress to revisit the additional stimulus potentially, and exactly what that looks like, I don't know. But I've sat here for months and said, if you have been laid off, and if you are called and offered your job back, that the end of July is coming. The end of July is coming, and that $600 extra per week is going to go away. And so please, if you're offered your job back, please take it. Number one, it's required by law that you take it, but number two, we're going to come to a point in which $235 is the maximum that you can make. Here we are in the middle of July, and we're just a week and a half or 2 weeks away from that. So. Who is with us from WLOX?
Hello, Governor. This is Hugh Keaton from WLOX, and I do have a question about the DMR for you. We have gotten word there was an executive order that funded DMR through August 31st, and I'm just looking for some clarification there on the specifics of the funding for DMR, if that is the case for August 31st, and what is funding and where the money is coming from. Thank you.
Thank you for your question, and I do appreciate it. As I have said since the beginning, it is critically important that the Department of Marine Resources, for those of you who live down on the Mississippi Gulf Coast, that the Department of Marine Resources actually function as the state entity that it is intended to be. There's a lot of reasons for that. And by the way, I have a lot of friends down there that are perfectly okay if we don't have law enforcement on waterways enforcing federal law on how many fish you can catch. I get it. I've heard from them too. But here's reality: we have to have law enforcement on the waterways in the Mississippi Sound. It is that is for the health and safety of my fellow Mississippians. That is critically important, and that is not something that just because the legislature went home without funding it, that can just go away. Much of the Department of Marine Resources, much of what they do is actually ensure that federal law and federal guidelines are followed. And so those, under the Attorney General's opinion that was issued years and years ago, long before this issue came up, it is very clear that those monies are utilized to make sure that those individuals can actually do their job. Keep in mind, I don't remember exactly how large DMR's budget is off the top of my head, but approximately $1 million is all that state resources go into running that agency. It's less than 10% of the total agency is paid for by state general fund dollars. And the reason for that is many of their responsibilities and many of their tasks, which, as we know, 20-something years ago were broken away from the Department of Wildlife, Fisheries, and Parks, so that's a coast agency that oversees coastal waterways, and it's critically important. And so the additional executive order that I signed recently did extend that funding. I think that's important. Keep in mind, I would most likely have already brought the legislature back in to deal with the DMR issue, except for the fact that I can't put 175 legislators plus lobbyists plus staff plus others in that building across the street when we know there are some 35 or 40 or 45 confirmed cases of COVID within the last couple of weeks. And so it's just not safe to do that. And so we're taking every necessary measure to protect not only those individuals that are involved in the legislative process, but also protect those Mississippians on the Mississippi Gulf Coast. I know that while I may not have grown up on the coast, and while I may not have ever lived on the coast, a big reason why I'm sitting at this chair right now is because of the broad, bipartisan, huge numbers that we received on the Mississippi Gulf Coast last year during the election, and maybe that's part of the fight that we're having. Maybe there are some individual House members on the coast that want to get back at me for whatever reason. But the reality is politics don't matter. We've got to run a government. We've got to govern. And that's something that we're going to do everything in our power to make sure that we get that done. Because I'm going to fight for those men and women on the coast who depend upon DMR, some of whom know it and some of whom don't necessarily.
Yes, Governor Reeves, you said that Dr. Burks earlier today believes that the mask order is working well in the 13 counties that are currently under a masking mandate. And I'm just curious, if the mask mandate is working well in those 13 counties, then why not go ahead and issue the mask order to apply to everywhere statewide? And Dr. Dobbs, I'm just curious, from your perspective as the state's top health expert, do you believe that a statewide mask mandate would help with the capacity issues that we're having in the hospitals across the state?
Well, I'll turn it over to Dr. Dobbs in a second. Taylor, thank you for that question. One of the problems that some of you seem to, even though I stand up here or sit up here and talk about it every day, that I'm having a hard time convincing you of, evidently, is the words on the page do not matter. I can write all kind of laws down on the page, sign it as an executive order and say, woohoo, look what I've done. I've done good, great stuff. If people don't comply, it doesn't matter. And so, as I've tried to do for a number of days and weeks, somewhat unsuccessfully evidently, is try to convince you that what's important is that we issue orders in such a way that we get maximum compliance with my fellow Mississippians. It'd be a heck of a lot easier for me just to sign the order so y'all quit asking that question. Then I wouldn't have to deal with it every day. But I'm here to tell you, I think fewer people would wear masks in the counties where it's most important if that's what I did. Otherwise, I'd do it. But I don't believe that's the best strategy. And here's why. We've seen it work. Earlier, 2 months ago, we issued mask orders in Leake County, in Neshoba County, in Newton County, in Scott County, in Atala County, in Jasper County. We had local buy-in when we did so. More people complied, and the curve was flattened. It worked. And by the way, those are rural counties where that wasn't easy to do, but it was done. I believe by outlining these 13 counties based upon the data that suggests it, sends the message to those individuals in those 13 counties that it is very, very, very serious, and it is very critical that you wear a mask and you wear one today. Now, it's also true that there are counties in our state where there's very little transmission. There's not a lot of them, but there is some. There's transmission everywhere. But when you talk about, say for instance, the state of Louisiana, I forget the exact numbers, but when you look at what Dr. Burks and her team, the criteria that they have in place, just to put things in perspective for you, in those counties in Louisiana or parishes in Louisiana, approximately 45 of their 60 meet their criteria for additional restrictions. In Mississippi, 6 of our 82 meet their criteria. And interestingly, of those 6 that meet their criteria, Forest is the only one that we have not currently implemented the mask mandate. And as Dr. Dobbs will tell you, Hattiesburg, the city of, has a mask mandate. And so in essence, each of those have mask mandates. My job is to try to develop a strategy that leads to the best possible outcome for Mississippians. Then I understand that there is debate, and I understand that different people have different opinions. I believe by targeting these 13 counties now, which we may add to or take away, will lead to better compliance than if I just simply signed an order which said, hey, statewide, everything's bad, wear a mask. Because at the end of the day, me signing the order doesn't do a dadgum thing to slow the spread of the virus. What slows the spread of the virus is you and your community wearing a mask, staying socially distanced. And so, to answer your question, my view, and again, everyone's entitled to their opinion on this, and there are good people that I like a lot and trust that don't necessarily agree with this. But in this instance, I'm convinced this is the best strategy for us to take at this time. Dr. Doctor.
Certainly, without a doubt, if we had more folks wearing a mask, we would have less hospitalizations, we'd have less illness. I mean, I think that's not in question. I do agree that there's some validity to the argument of the extra attention that you get if you're one of the hotspot counties, right? So folks get worried about that. So there is an impact there. I would expect to see more hotspot counties be added to the list before long. And when they get added, I don't think it's going to be a week sort of thing. I think it's going to be multiple weeks because you don't see your impact for multiple weeks. So that's going to be ongoing. And, we'll continue to watch it closely. Whatever it takes, whatever the best strategy to get masks out, we'll continue to support that.
And let me just add to that. The one piece in those 13 counties that we haven't done that everyone should be considering is there appears to be a growing consensus around lots of spread happening at bars. And so that is a topic that we are currently considering, and the conversation is going something like this: should bars statewide be closed? Should bars in those 13 counties be closed? Or exactly what does that look like? We know what's happened in Florida. We know what's happened in Texas, but we also know that it appears that there are a lot of reasons for the uptick in cases, but one of those reasons is young people going to bars, having a big time, and completely ignoring the downriver effect that might have. What do you?
Just a quick question, Dr. Dobbs. I had a lawmaker reach out to me today and said, look, I tested positive in my local district. I'm not really sure if I'm part of the count for the outbreak at the Capitol. I know you had referenced that it was difficult to track all those down. How do you track those down?
Well, I'll tell you one of the challenges has been there's a mandated reporting system. It's by law, clinics and labs have to report the cases to us, and so we've seen a delay in those, especially through the rapid test. Because if you've driven by any of the clinics that are busy, we're having to track those down one by one and make sure that they're reporting. And so anybody out there who's a clinic or a doctor, it is against the law not to report your cases to us. And so that's one of the challenges. It may well be part of it, and certainly will get added, if it's not. But that's part of the process. But like every system, when it's overwhelmed, there are delays, and I do believe we're having reporting delays.
Dr. Dobbs, approximately how many employees do you have at the Department of Health?
We have about 2,500 folks altogether.
So-
But in our epi division, it's like the same 8 people doing all the work. And I'm one of those 8. And I spent time doing tests myself because we have a talented bench, but it's pretty shallow. And so Jim Craig and I, who's my senior deputy, sometimes we have to fill in and do tests. So, or do data entry, sincerely. So we're a shallow bench.
Yeah, the only reason I asked that question is because I would like to send a message to that lawmaker who called you. If they had the time to call you, they probably could have called one of the 2,500 employees at the Department of Health, or the 8 who are working in the, on epidemiology issues with respect to this, and say, hey, I tested positive in my local community. I want to make sure I'm on that list. That would have been a far better use of time. But I get frustrated with some of the gamesmanship that occurs out there, and let's all work together here and make sure that we are pulling in the same direction. Yes.
CJ Lemaster with WLBT has a question.
Hey, Governor. Hey, Dr. Dobbs. I had to ask this. Robert Foster, former gubernatorial candidate and state lawmaker, has gone so far as to say these restrictions amount to communism, that this should be called the control virus, also calling you and those who support mask mandates Marxists. Governor, how would you respond to that? And I have a follow-up after that.
Okay, thank you, CJ. I would not respond to that. I will tell you that it became very clear over the last several days, and certainly in talking with Dr. Birx today, that President Trump and his administration support the wearing of masks, and I think it's critically important for the people of our state that if we're going to slow the spread of the virus, the best way in which to do so at this time, of the tools that we have available, is to wear a mask and to make sure you maintain social distancing. I think that's critically important.
All right, thank you. As far as the follow-up, you talked yesterday about keyboard warriors putting out false information, and this one's actually for you and Dr. Dobbs, but what happens when it's a current state lawmaker putting out this information? We had a representative in DeSoto County, Dana Criswell, posting what looks like misleading recovery rates and survival rates, basically dividing the county's cases and deaths by the population in DeSoto, and he claims a 99.99% survival rate and 99% of people there not positive. Dr. Dobbs, can you point out the issues with a statistic like that? And Governor, can you talk about the dangers of a legislator putting something out there that's shared without question on social media?
I'll have to go back and look at those numbers, but those sound way off from what we've seen. There may be some strange way that it's getting sliced up. We know the mortality rate from multiple perspectives of diagnosed cases is going to be, above 1%. But of total cases, it's probably going to be less than 1%. The total number of people infected from multiple lines of evidence is going to put it, and DeSoto is a hot spot right now. I mean, they're having a lot of cases right now. So I think there's just some error in the calculation. It's just not accurate.
What I would tell you is, one of the challenges that we have in this country right now is there's a lot of division, and there are a lot of people who believe one thing that may or may not be accurate. And I haven't seen Representative Criswell's social media post, and I know him, and I know that he is a good person. What I would simply tell you is DeSoto County right now is one of the 6 counties in the entire state of Mississippi that is being looked at by the White House, and they are extremely concerned about the number of cases. And there are those locally that can choose to ignore that, and that's certainly their prerogative. And look, I'm just as I defended those individuals who were protesting the orders that we put in place back in March or April when they were coming around the downtown Jackson and honking their horn, just like I defended those individuals who protested, who I think contributed mightily to the spread of the virus in late May. I'll defend every current state representative or state senator's ability and First Amendment rights to go on social media and make posts whether I agree with them or not. And that is certainly their prerogative if they do that. My job is to tell you what I believe to be the facts as I see them. And my view is, as I mentioned earlier, regarding things like herd immunity, it's just the numbers just don't work. The numbers just don't work for us. And keep in mind, we want to talk about, and most of the questions are regarding COVID, but when you talk about the hospital situation in the state, Dr. Dobbs said earlier that a third of the patients that currently are in ICU beds in Mississippi, approximately a third of those patients, are COVID related. But understand that if you have a heart attack or if you have an automobile accident and you have trouble getting into an ICU bed, whether that person that's taking up that bed has COVID or not, it's a problem. It's a real problem. And so it may not be a problem for that 22-year-old who gets COVID-19 and doesn't have major symptoms, but it's certainly a problem for the state. And that's something we got to continue to work on. And look, I'm someone who, everyone has a different opinion, and everyone is entitled to their opinion. My job, I believe, and I was elected to do, is to tell you, based upon the facts that I have today, the opinions that I'm sharing are what I truly believe in the bottom of my heart to be the best movement for our state. They're not hardcore political positions. They're not really based upon political philosophy. It's just based upon the data. It's based upon the facts. And that's the way I see it. And I've got to call them like I see them at this point. And I recognize that people who agree with me on 98% of political issues may not agree with me on this. I also understand that those who disagree with me on 98% of political issues may agree with me on this. This is not like a real political philosophical divide here. There are people on both sides that have differing views. All I can tell you is my guess is that I have more access to more information and more data than most people, and I was elected to give the people of Mississippi the best advice I can given the facts and the data as I know them today, and that's what I'm trying to lay out for you.
Jeff Pender with Mississippi Today has a question.
Good afternoon, Governor. I believe today is a deadline for appointments to the State Flag Commission. I was wondering if you had picture appointments at this point, and if you can say who they are.
I have not gotten to it yet, and therefore I can't say who they are. I am hopeful to be able to get on that once we get done with this press briefing. But I will tell you, you may have noticed in the legislation that the restrictions that they put on the governor's appointments are very, very tight, very limited. They did not put any restrictions on either the leader of the House or the leader of the Senate's appointments. This is an executive branch agency, and we'll try to get through that hopefully today, if not really, really soon.
Patrick McGee with Sun Herald has a question.
Yes, Governor, you've addressed it some during this press conference about BARD, but can we expect an order from you this week on closing some BARDs?
I don't know that I can tell you with certainty that you should expect an order this week, but I will tell you that it is a definite possibility. It is, the conversations are being had. It is not in my DNA to shut down private businesses, so this is something that we're having a lot of conversations about. I will tell you that there seem to be distinctions between those who are outdoor versus those who are indoor. And so there's a lot of nuances there that we're trying to work through, but I am concerned as to potential transmission in bars.
Hugh over at WLOX has another question.
Yeah, this is a question from Dr. Dobbs concerning data reporting. You had said that about 80 new COVID patients are being admitted into Mississippi hospitals a day. Would it be possible on your daily reporting to also include the people who have been discharged from the hospital, especially in the ICUs. Would that be possible to include the discharges in your daily reports?
You know, the way that the hospital sends us information, they give us a total number of new admissions. They don't give us new discharges. I wouldn't think the back calculation would actually be precise because some of those might end up be deaths. So I'll look at that. We certainly can report the number of new hospitalizations every day, and we'll investigate that other question because in our daily reports they don't give us that from the hospitals.
Thank you, Renee. Thank you, Governor. I just noticed, I apologize for coming in late, but I just noticed the $56 million that were, at least for the revenue, that was estimated surplus in the state revenue in the legislative budget office. Governor, is there any bit of that you're intended to use to help unemployment, to help certain agencies? If you wouldn't mind sharing that with me.
Thank you. I presume you're referring to the June 30th cash position. We worked very closely with the Department of Revenue, with our leaders in the Appropriations Committee in the Senate, Senator Hobson, as well as our leaders in the House Appropriations Committee as well, Representative Reed. We're going to be able to close out the fiscal year that ended June 30th in such a way that meets our requirement to have a balanced budget. Revenues held up relatively strong through very challenging times in March, April, May, and June. Of that, I am very pleased. That is a silver lining. That is a positive that's occurred. But I don't have the ability to take any of that surplus and spend it on other items. We can only spend money on non-constitutional items if there is an appropriation. And so I don't anticipate any of that $56 million being available for us to spend plussing up budgets or anything along those lines. That would be a function that the legislature would have to do. Seeing no further questions at this time, I do just want to one other time thank our Restart Mississippi group. If you are a small business in Mississippi and you've been having a hard time finding certain PPE that you may need, www.ms-ppe.org lists some vendors that you might can go to. Some of those vendors we may have utilized in the past to get community masks and things such as that. But that's a way for us to take small businesses in Mississippi, hook them up with other businesses, and help in our local communities. And again, thank you to Director Turner at MDES for all that you are doing. And thank you to the press for giving us this opportunity to talk directly to the people of Mississippi. I believe in my heart that people are paying attention. I believe that we're seeing better compliance, particularly in those 13 counties, but I believe it's true all across the state. More people are wearing masks today than were wearing it yesterday, and more people are going to wear it tomorrow than were wearing it today, and that is critical. Stay socially distanced, 6 feet apart, wear a mask, stay at home if you can. If you're in the vulnerable population, definitely stay at home, and working together we'll get through this. Thank y'all, and God bless.